All right, welcome everybody. Just a bit of housekeeping. Again, I'm Angie Grover and I'm co-founder and COO of Metopio. For today's webinar, we are going to have the chat on and we'll be managing. So if you have any questions or comments during the presentation, you can go ahead and add them in the chat. If that doesn't work for you some reason, we also have the Q&A. Either are fine. We'll be monitoring those. We have a poll up on the screen. I'm going to close that here in just a moment as people join us. The audience will be muted, so those questions are best in the chat or Q&A. The slides and recording will be distributed after today's call. So again, for those of you who don't know Metopio, we are a platform and a partner who provides data and analytics to automate your assessments and health improvement plans. Our intent is to enhance your productivity so that you are able to spend more time engaging with the community and putting your insights into action to have a positive impact on the communities that you serve. So with that, I'm going to end the poll and we'll take a quick look at while folks have joined us today. So kind of across the board, building trust across the collaboration. I know Kimberly's going to touch on that. Strategies for aligning regional and local health priorities without losing community voice. That's very important. How we collaborate across these CHNA or CHA processes, practical tips for sustaining the collaboration, and tools for making data collection easier. So I think if you've joined us for any one of those reasons, you're going to get a lot out of the webinar today. So with that, I am pleased to introduce our panel of leaders in North Carolina to talk with us about collaboration, community, and collective impact. So first we have, I gotta manage my slides here. There we go. First, we have Erin Hsu. She is the Public Health Director at Cabarrus Health Alliance, located in Cabarrus County, North Carolina. Erin has 20 plus years of public health experience, including community engagement, program management, and administration. I know this from working with her. She's very passionate about access to care and services, making data-driven decisions, and rebuilding the trust in public health. Erin leads a team of 300 incredibly talented public health staff, and we're excited to have her join us. Kimberly Dull is the Senior Director of Community Health and Social Determinants of Health for Novant Health. So wanting to use her powers to good, I think you need a wand, Kimberly. Wanting to use her powers for good. She has held various leadership roles in nonprofit, higher education, and healthcare for the last 17 years. She currently leads social driver strategy, community health services, and community benefit teams across the Novant Health system. She and her team share a vision of health equity in all communities through patient-centered interventions. And Kristen Soni serves as the Director of Community Health Needs Assessment for Atrium Health, now part of Advocate Health, covering North Carolina, South Carolina, Georgia, and Alabama. She brings over 2 decades of healthcare experience in prevention, wellness, patient experience, as well as strategy and integration. Kristen maintains her national counseling license, which comes in handy in these collaboratives and working with us, and brings a patient and community-centered approach to her work, making sure that every voice is lifted. Again, I am so thrilled to have these 3 wonderful leaders on our panel. Welcome to everybody today. Kristen, can we get it kicked off? Can you, our agenda is a little bit about the collaborative, some of the opportunities and challenges we're all facing in this moment in time, how we innovate and support a collaborative effort, and then I'm not going to let you leave without some good advice from today's leaders. So having said all of that, and now I'm going to turn to Kristen to talk a little bit about this really unique collaborative. Kristen?
Yeah, thanks, Angie. Thanks for having us. We're excited to share a lot of our work. So as you can see on the screen, the Central Carolina Community Collaborative is made up of 6 health systems. And so you can see that at the top, that equates to almost 30 hospitals. Then you can see in the public health space, we have 10 health departments in the collaborative. And then down as in the community organizations, we have 4 United Way agencies, and then we also have a couple technical partners that we use, so Delaware Consulting, the UNC Institute for Public Health, as well as UNC Charlotte's Urban Institute. So we've got a lot of great organizations at the table. So let me tell you a little bit about why we came together. So we were at a community meeting. This was just coming out of COVID, and we were just talking about some of our pain points in this work. And we really started talking about if we can work on a global pandemic together, we can certainly start to tackle this work together. So I think what we found is that there was so much duplication in our market that honestly our community was a little confused of who was doing the work and what measures were being taken. They just didn't really understand the requirements that we had as organizations, and there was so much duplicative work. So while those of us on the call have been working behind the scenes for at least 3 years now to try to make the collaborative what it is today, we officially became the Central Carolina Community Collaborative in late 2024. So we are funded for 3 years by the Duke Endowment, and that's really exciting for us because it allows us to really try some new things and really look at this work through an innovative lens. So we're just really glad to share some of our work with you today, and I'm excited to talk about it. Thanks for having us.
Yeah, of course. And I'd love to, Erin, have you dive a little bit into the landscape and your why? Why the collaborative? Why now? What's happening that's brought you to the table along with a lot of your other public health leaders in the region?
Thanks, and I echo Kristen's word of thanks. Thanks for having us. Thanks for allowing us to revisit our why in our past and share this exciting work. So, from the public health landscape, public health has had a bit of a metamorphosis over the last few years. Certainly, coming out of the pandemic, we were feeling a lot of different pressures, and so when it was time to look at doing these assessments again, we wanted to take a moment to say, how can we improve upon the last cycles that we've been through? And so really, we wanted to collaborate. We wanted to work with partners who also had to do this work, but not through the public health lens. And so we know that collaborating often leads to greater successes. And so we started just a few of us having these conversations. And as Kristen just shared, it's grown into quite a large body of individuals and teams that are bringing their talents and their resources, but most of all their experience, because what we also have right now are a lot of new talent in our world. And so a lot of people who are going through this process for the first time, and that can be really daunting. That can be really scary. And so by working together, we're able to share the wisdom of the past and bring in a lot of the talent from new individuals. And so we know there's strength in numbers. And we know that a lot of times when we work together, we end up with a lot stronger of a process and a product. So,
Right. Right. And Kimberly, as you're thinking about what the work to be done was, thinking about the why that brought everybody together, as Novant sitting at the table, what are you looking at in this collaborative to get done?
Yeah, Angie, thank you for the question. And also thank you for having us today. We're all really excited to be here. So I am a leader in Novant Health's Office of Health Equity and Community Health. And our vision is to ensure that everyone can achieve their highest level of health. That is a tall order, and we know we can't do that alone. The reality is there's not enough staffing, there's not enough funding, there's not enough programs that can meet that need, particularly if we try to do it ourselves. And our scope is 17 hospitals just in North Carolina that are on this same CHINA cycle currently this year. So in order to address the community's needs and understand them most thoughtfully, we have to partner together in this work.
Yeah, and so I'm assuming everyone on the phone knows this, or on the phone, that's a little old school, but so in this collaborative, you are producing not only community health needs assessments for the IRS requirements that hospitals have, but community health assessments for the Foundation of Public Health and perhaps even for accreditation in some places, right, Erin?
correct. Yes.
Yeah, so, using that as an impetus to move forward is pretty powerful. So I wanted to also take a moment to share, I'm gonna go back and share my screen with you all, a little bit of what we've launched recently here, and have you guys talk to kind of the power of resource sharing. So not only are you doing your CHNAs. And as you referred to, or CHAs, what you referred to earlier, Erin, was your CHIPs as well. But you've also shared this with the community. So this collaboration is big, small. Maybe you could talk a little bit about the playing field and why using technology or being thoughtful and innovative in not only producing the report, but moving this work forward. How you guys thought about that as the collaborative.
Absolutely. So a little bit about public health in North Carolina, because I imagine we've got individuals joining from all over. In North Carolina, local public health is what's called decentralized, meaning in all 100 of our counties, we have public health staff working on both mandated services and services that are needed because of community needs. And so, as you can imagine, across 100 counties, some health departments are better at things such as grant writing or being innovative. Some have a greater local county support, and some have to find unique and strategies to move work forward. And so creating this, what I call a community of practice of individuals coming together to do this work, really helps lift all of us. So individuals who have a lot of resources are walking away still learning a lot and having additional resources through things like Watokio and this technology. But definitely our counties who are what I would call resource limited are really joining this collaborative and finding not only the technical support, but the experience of the individuals who are doing the work and have done the work. And so I think it's just incredibly helpful, as you said, to kind of level the playing field, but also for our communities who have not had this type of data at their fingertips, literally at their fingertips, to be able to say, I want to learn about health behaviors in these zip codes. Our communities are able to have that data now, where perhaps before they were not able to have that.
Yeah, that's incredibly important. And Kimberly, when you think about that, I think you said 17 hospitals in North Carolina. So when you think about a resource like this and aligning those efforts across the community, can you speak to a little bit of the value, how what Erin just describes translates into your work at the hospital as well?
Oh, absolutely. So I think because of our scope and scale, we do see some community needs that are consistent across our region, but we also see a lot of nuance that is community specific. I've been in the community health needs assessment process for 5 cycles now. And so there have been many things that we've seen carry through, many areas where the needs have stayed consistent. But we've also seen things like the emergence of social needs as a concept, the concept of your lived experience, acknowledging that that has an impact on your health outcomes, the prevalence of substance use disorder, the changing demographics and populations in the communities that we serve. The more that we can come together as a collaborative and understand from a secondary data lens, how are those shifts occurring? What are the insights that we can view and all share the same language? Then the better use of our community members' time when we approach them and say, can you give us your insights in how we can solve these problems together? The worst possible outcome is for us to engage a neighborhood association or a group of community members and them to say, we had this exact same conversation with your colleague across the street and with you 3 years ago, but we don't know what either of you are doing to address our needs. And I think that's where us partnering together, not out of a sense of competition, but out of a sense of collaboration, so we can actually serve communities more effectively, is really important.
Yeah, and Kristen, I know you've been preaching this since we started, right? And so I'm interested because you've also been doing this for quite some time. Just maybe some of the tactical benefits you've seen about sharing data and about offering some technology to support this work, how you've seen that reflected in the collaboration.
Yeah, I mean, Angie, we could probably talk for another hour about all the benefits to that, but when you pick up a report across our markets, things were so drastically different from county to county or hospital to hospital. It was different data sources, it was different timing, and there just really was no apples to apples comparison. So, what you've heard me say a million times is what this is doing for us is it's creating that single source of truth. It's creating that that same platform where we're all looking at the same data at the same time. And, we ultimately came together to find efficiencies of scale in the report process. But it's getting to the good stuff. It's getting to the actual impact work that we're going to start now. And, just as Kimberly talked about, was we now can look at that secondary data in a matter of minutes, which was taking us weeks and months before to look at. So, with the Metopio platform, we now can click a few buttons. We can really get a snapshot across all of our markets. And that's where the conversation's heading now is, okay, what are we going to do with that? And what do we do together? So what are the things that, Kimberly talked about of where are all the issues that we share? And certainly there's some nuances in the market, but in general, we share a lot of the same issues. And so the work is really starting to transition now to, what are we going to do about it? And how do we really impact the community?
Yeah, and Erin, before we move on to, the best of advice, I'm curious too, we're all in, reading my husband jokes breaking news every morning about the changing environment, and yet working across the country, Metopio has partners across the country, both in public health and healthcare. People are still doing this work. It's still critical work to drive us forward. But I'm curious from your perspective about that element of collaboration where, what did collaboration look like for you all before kind of, having this actual collaborative, maybe at a larger scale? I'm just kind of interested in the shift and how that's benefiting the work that you're trying to do.
Yeah, great question. So, I'm going to brag on my community. We've long been great collaborators within our county. And so our community has been really blessed to have partners come to the table, cycle over cycle, wanting to have their voices heard, wanting to share the data that they are collecting, both anecdotally and otherwise. And so I'm really proud of that. What this new collaborative has allowed us to do on a regional and what is also going to be what we feel like is kind of multi-state because of our health systems is, to Kristen's point, understand, okay, apples to apples, what's happening in your county, what's happening in our county, and how can we now move the needle, make a difference when it comes to impact, when it comes to programming, when it comes to identifying resources to address the needs, because health doesn't stop at county lines. I can look out my window right now and I can see the next county over, who luckily is part of the collaborative. People in the next county over are going to benefit from the work that we are doing. People in the counties to the east of us are going to benefit. And so that's what I'm most excited about, is that the collaboration that we've done so well on a local level within our county, now we're doing on a regional level and hopefully even broader than that moving forward.
Yeah, one of the questions we got, and this is for anybody who wants to speak to this, is, if you're all using the same data, you all have kind of the same structure for a report, like how do you ensure community voice and how do you make sure it's unique for the communities that you're serving? So I'm interested in your perspective on that. I'll open it up to anybody who wants to jump in.
I'll jump in and take that one. So that was really part of the planning from the very beginning, is that it was really important for us to come together where there's efficiency to scale, but then not to lose that local feel and that local voice. So really what the collaborative has done is created sort of behind the scenes or behind the curtain work that supports all the local communities. Then the local communities have the ability to customize as they'd like. So for example, we came together to do a shared survey. And so we have a baseline survey that all of our collaborators used, but then they have the option to add a couple questions that would be specific to their market. So the same thing with all of the data that we put into Metopio is that there's a baseline, but if a market or a community would like to add some more, they absolutely can. Same thing with the report. We're creating a template that everybody can use, but if they'd like to add an extra topic or an extra page, they absolutely can do that. So it's really the baseline that is the same, and then the community has the ability to customize that makes sense for them.
And I would just add, Angie, I think one thing that Kristen and Erin have done so beautifully, we call it the choose your own adventure concept, where everyone is welcome, but no one is pressured. So we have partners that are in the collaborative today who have said, you know what, we're too far along in our current cycle, but we want to come alongside you because we're building the infrastructure for 2028. There is no wrong door, there's no wrong level of involvement, and there's no wrong time. Because again, the more that we get these best practice sharings, these ideas, this shared data, just the better off we all are.
And Kimberly, to add to that, we're all required by all of our agencies that require us to do this work. But this is such a bright spot in my day, is that everybody in the collaborative wants to be there, and they've all really, pulled up the chair and really participate and super engaged. And it's such a bright spot in this work that everybody's there because they really see the bigger picture.
Yeah, there's rarely a week that goes by where someone doesn't send an email and says, how have you addressed this through your process? Or has anybody ever thought about doing it this way? And it's always met with a lot of responses and a lot of support. So that's always nice to see.
Well, and I will round out that conversation, but by just saying that the platform is built to expedite and automate the things that can be automated and really shift your work from kind of grinding through all that data. You can get it right on the platform and moving those efforts into that lived experience and bringing in your qualitative so that, if you have limited time, you should be spending it with your community, right? And bringing that in and validating the secondary data and really understanding how people are, seeing their opportunities and challenges. So I told you, half an hour goes by really quick, and I want to make sure that we tee up advice for everyone on the call. If you have any questions, go ahead and continue to add those to the chat or the Q&A. But since we have such great leaders, I know you're in the messy middle. I'm not sure if anybody really has their CHNA or CHA completely done. And so we know this is a work in progress and that you've made a lot of progress. You're sharing this data. You all are in the work right now. And as Mentopio, as I said, we've seen organizations and communities across the country really turn to this model, whether they're bringing in the public health and hospitals, or the public health and their mental health boards, or public health and the FQHCs, public health, and sometimes even the payers. Everybody knows that we need to understand the community context as drivers of poor health outcomes so that we can really work and sort out who's the best to address some of those. So before we let everyone leave, I'd love to go Kimberly, Erin, and then Kristen. What's one nugget of advice you might give the folks on the call about, maybe I sit at the same tables, but how do we get this work to move forward? So Kimberly, let's start with you.
Yeah, so I'm actually going to squeeze in two so fast. But I think one of those is I think there are very few entities in our work that are getting more staff. Right. So I think we really need to consider how can we maximize our investment of time. And when it comes to data-based solutions, that either means we're investing our staff, we're investing in consultative staff, or we're investing in a tool. And the ability to invest in a tool so that we can then be out forming relationships and executing has been transformative in our work. Related to forming those relationships, my advice would be to seek what relationships can you form or do you already have that are truly in service to your community's health? Because I think Erin and Kristen have both alluded to that. We are all anchored in a commitment to do right by our communities. And so we have come to the table to seek to collaborate in that effort. It is all relationship based, and those relationships will continue after our CHNAs are published.
Sure. Erin, how about you?
Yeah. Well, if we all had $1 for every time we heard the word collaborate on this call so far, we'd be able to take the rest of the day off, but I'm going to hit on it again. We're always just better when we collaborate versus when we focus on competition. I've not been a part of a collaborative process in my public health career where I walked away thinking, gosh, it would have been better had we just done that alone. And I think this is going to be another prime example. I realize that's easy for me to say coming from the public health perspective versus my friends in a health system where sometimes, we do have to think about markets and those sorts of things, but we are just so much stronger and I believe smarter when we row the boat together.
Definitely. And Kristen, what advice do you have to offer?
Yeah, again, so much, but when we started these conversations, we never set out to be one of the largest collaboratives in the country, and yet here we are. And I think it's really about how do you just start the conversation small? How do you really find those like-minded people? And Kimberly, Aaron, one of you mentioned that earlier. You know, that's been the real beauty here is that while, you know, I'm with Atrium and Kimberly is with Novant, and those are seen as competitors. But in this space, there's not. And that's what we've had to really educate folks is, you know, we come to this space with locked arms, ready to do some great work to serve our community. And I think that's been some of the education we've had to do. And the conversations have just continued to roll. And I think that's where I would give advice is just start the conversation somewhere with a competitor, with a health department, with an FQHC. Just start the conversations and see where it goes. Because I think really our vision has caught on, and I think people are really seeing where we're headed.
Well, and I have a couple questions. I just have to say, in the spirit of collaboration, everybody has shared their contact information because we know that you guys are doing this work on the ground, and there's no need to recreate the wheel. So you're welcome to reach out to our speakers. We're so fortunate to have them on today. And there was a question about, and goes to, you know, how is current federal and state cutbacks affecting collecting data? And I'll just take a quick stab at that from the Metopia perspective. I would love you guys to weigh in before we log off here, but you know, it's really interesting. Metopia has collected all the data that we could possibly collect before changes in the administration happened, but we also are really good at curating the state data, which often is more granular and more specific to your communities. And so the third thing is, I would say, as Kristen alluded to, we also conduct surveys. And so the way we're approaching this is let's keep an eye on what's being shared at the federal level. That's a benchmark we've had, you know, for a long time. Then we've got the state data or any local data, your public health surveillance data, anything you can bring to the table that you're already collecting. And then can you create some of your own data with that lived experience and the members of your community? So this work just needs to continue to be informed by data, and we'll keep moving forward, I think, collectively to make sure that happens. So last poll before we leave today is we do these webinars on a regular basis. We are so fortunate to have leaders like Kristen and Aaron and Kimberly in the Metopia network across the country. And folks are doing this work in a really meaningful way. And so every month we try to host a webinar where we bring in subject matter expertise to help you do your work better. So there's some ideas for future webinars. Would love to know what's on your mind. If you have any other ideas, you can put those in the chat. But I just once again want to thank everybody and get you out of here on time. We have recorded this webinar and we'll share the recording as well as the slides with everybody. Kristen, Aaron, Kimberly, so appreciative of your time and so honored to be part of the work that you guys are leading to make really meaningful change and health improvements in North Carolina. So thank you very much.
Thanks, Angie.
Take care, everyone. We'll see you on the next webinar.